As you've learned, PDPM affects how occupational, physical, and speech-language pathology therapies are reimbursed to your facility. While skilled rehabilitation may be mostly thought of as one-on-one services, group therapy and concurrent therapy treatments are clinically sound service delivery options for some patients under some circumstances. Both treatment options can provide value to patients while delivering high-quality, evidence-based interventions. It is important to note that the definitions for group and concurrent therapy vary by payer source. For example, Medicare A and some managed care reimbursement services define these treatments as follows. Group therapy is the treatment of 2 to 6 patients who are performing similar activities that are part of their plans of care regardless of payer source. Concurrent therapy is the treatment of 2 patients at the same time who are performing different activities. Now, let's look at how Medicare B and some other reimbursement sources define these therapy treatments. Group therapy is the simultaneous treatment of 2 to 4 patients, and the therapist divides their attention between all participants regardless of payer source. As for concurrent therapy, this is not a service delivery option for Part B patients. Let's dive in a bit deeper on how this all works under PDPM. Under PDPM, up to 25% of the entire number of minutes provided per patient, per discipline, can occur through group and/or concurrent therapy. These minutes will be identified separately and recorded on the MDS with no further allocation of minutes, as currently required under RUG 4. If this 25% threshold is exceeded, this will be deemed as non-compliant in a communication to the provider and is a non-fatal error. There is no penalty at this time, but the communication is clearly meant to alert the provider that their future practices must comply with these new guidelines. It's important to any skilled nursing facility to not underestimate the potential positive effects of group and concurrent treatments. Some of the benefits of any form of therapy that involves more than one patient include peer support and encouragement, increased motivation, information exchange and sharing, comparative self-analysis, and learning from peers' skill levels. Assistance in recognizing one's own problems are not unique and that peers experience similar challenges. More realistic simulation of the typical, everyday environment in which patients are asked to maintain their new functional skills. Aegis Therapies analyzed our own data for over 5,000 courses of treatment during 2018 that involved some element of group and/or concurrent treatment. When compared to those who received only one-to-one treatment, patients who received at least some non-one-to-one services made better functional gains and were more likely to return back to a community setting after treatment. At Aegis, we continue our promise to keep you informed on changes in the reimbursement world and support you along the way. Stay up to date on this evolving environment by checking our resource center for more information to help guide your path to success.